Hello everyone. Today we will discuss about the common antibiotics which are used in pediatric population. First we will discuss about amikacin. It belongs to aminoglycosides group. Mechanism of action, it is going to inhibit the peptide synthesis and it acts against gram-negative and aerobic bacilli. It exhibits post antibiotic effect and concentration dependent killing, so it is to be given once daily and at higher doses. Dose which is usually given 15 mg per kg per day IV. Side effects include nephrotoxicity and ototoxicity. Second, that is ampicillin. It's an extended spectrum penicillin and it covers the gram-positive cocci, bacilli and few gram-negative organisms also. Mechanism of action, it is going to inhibit the cell wall synthesis and given by IV or oral route. IV, the dose is 100 mg to 200 mg per kg per day and 6 hourly. And for meningitis, it's given at higher dose, that is 200 to 400 mg per kg per day, and the side effect include hypersensitivity reaction. Now we'll talk about the amoxicillin. Amoxicillin, it is similar to ampicillin in its mechanism of action, but it is given only orally. And the formulations which are available are, in the syrup form it is 125 mg per 5 ml, but in tablets it is available as 250 or 500 mg. Amoxicillin alone, it is not used for meningitis, and amoxicillin, it is combined with clavulanate to increase the sensitivity and efficacy of both, because clavulanate, it is a beta lactamase inhibitor, so it reduces the destruction of amoxicillin by beta lactamase enzyme. And the formulations which are available are syrup 156 mg per 5 ml or 228 mg per 5 ml, but in tablet form it is available as 375 mg or 625 mg. Now we will talk about the ceftriaxone. Ceftriaxone, it is a third generation cephalosporin. It is resistant to beta lactamase producing organisms and works against gram-negative cocci, gram-negative bacilli and anaerobes. Dose which is given is 50 to 75 mg per kg per day every 12 to 24 hourly, but for meningitis it is also given as higher doses, that is 100 mg per kg per day. And ceftriaxone, it is only given by IV route. Side effects include hypersensitivity reaction, pseudomembranous colitis and diarrhea. And diarrhea will be due to gut flora disturbances. Next we will talk about cefixime. Cefixime, it is a third generation cephalosporin and it is given orally. Dose which is given is 8 mg per kg per day, OD or twice a day. For enteric fever, it is given at higher dose, that is 20 mg per kg per day. Formulations which are available in the market are, in tablet form it is available as 200 or 400 mg strength, and in syrup form 50 and 100 mg per 5 ml. Vancomycin, next is vancomycin. It belongs to glycopeptide class, and mechanism of action, it is going to inhibit the cell wall synthesis and it works against aerobic and anaerobic gram positive bacteria, and it's only used in serious infections like caused by MRSA, that is methicillin resistant staph aureus, and also used in pseudomembranous colitis which is not controlled by metronidazole. And the dose which is given by IV route is 40 mg per kg per day every 6 hourly, but for CNS infection given as higher dose, that is 60 mg per kg per day. And the side effect will be Redman syndrome, and it is due to histamine release. Next we are going to discuss about the azithromycin. Azithromycin, it belongs to macrolide group, and mechanism of action, it will be going to inhibit the protein synthesis and it cures the atypical organism infection which is usually caused by mycoplasma, chlamydia, H. influenzae and pertussis. Regarding route and dose, azithromycin is given by oral route, and day 1 it will be given as 10 mg per kg per day empty stomach, followed by 5 mg per kg per day for next 4 days. Maximum it's given as 500 mg strength. Side effect, it is allergic reaction and QT prolongation. Now we will talk about the anti-tuberculosis treatment, and there are new things which are added in the anti-tuberculosis treatment and we need to know about this. The first line drugs include isoniazid, rifampicin, pyrazinamide which are bactericidal, and ethambutol which is bacteriostatic. The regimen which is followed as per the NTP guideline 2019, only one class of patients is present, no class 1 and class 2. Daily regimen consists of 2 HRJD, that is intensive phase for 2 months, 4 HRE, that is continuation phase for 4 months. And the exception includes neural and spine TB, in which continuation phase extend up to 10 months. New thing is addition of ethambutol in continuation phase. The pediatric formulation is specific. This includes isoniazid 50, rifampicin 75, pyrazinamide 150 and ethambutol 275. Among these, the HRZ is available in one tablet and ethambutol 275 is present as separate tablet. Now we are going to talk about the pyridoxine role and steroid role. Pyridoxine, as per current recommendation, it is to be given routine B6 supplementation to all the children who are receiving ATT or IPT. Prophylaxis dose is 10 mg daily because isoniazid is going to cause peripheral neuropathy. And the steroid role, it's only limited in patients with CNS TB, spine TB, miliary TB, TB pericarditis or TB uveitis. Next is side effects. The side effects include, first of all, we will talk about the side effect of isoniazid. These are skin rash, hepatotoxicity and peripheral neuropathy. Of rifampicin, these are orange-red discoloration of urine and sweat, and this is normal and we should make patient and parents aware of this. Next is hepatotoxicity. Regarding pyrazinamide, it is also hepatotoxic and joint pain and hypersensitivity reaction are the other side effects. Next is ethambutol. Ethambutol, it is going to cause specific ocular toxicity which is dose dependent and it is going to cause red-green blindness. Now we will talk about the last antibiotics which is used, and it is cotrimoxazole and it belongs to sulfonamides group. Mechanism of action, it is going to inhibit the bacterial folic acid synthesis and it acts against gram-negative organism, also acts as antimalarial and against the toxoplasmosis. And the use, it is used in UTI prevention and treatment, recurrent respiratory tract infection prevention and treatment, and as well as for diarrhea and typhoid and dysentery. The doses which is used are 5 to 8 mg per kg of trimethoprim plus 25 to 50 mg per kg of sulfamethoxazole. So formulations which are available in the market are syrup form, it is available in 40 mg of trimethoprim and 200 mg of sulfamethoxazole per 5 ml. And in tablet, it is available as 80 mg of trimethoprim and 400 mg of sulfamethoxazole. And the side effects which are commonly present are kernicterus in newborn, hypersensitivity reaction and crystalluria.